Hi, and welcome to How Assess Carpal Tunnel Syndrome, part of our SomaVeda Thai Yoga Therapy assessment series on signs and symptoms. I'm Dr. Anthony James, and I'm happy to be your presenter today. All right, the first thing we're going to talk about is a clinical hand exam or direct observation. Now, direct observation is just exactly what it sounds like, to directly observe the client. Have a look at them, peruse them, scan them, listen to them, watch how they stand, sit, walk, look at their color, look at their breathing. These are a few of the signs and symptoms that can give you really strong indications of both physical, energetic, and spiritual issues that have to do with disability, with pain and suffering, and so on and so forth. Now, so we're talking about the hand and we're talking about carpal tunnel. All right, so check for obvious signs or symptoms of abnormality, pathology, odd or unusual color, shape, and character and appearance, obvious atrophy, distortion, unusual curling of the fingers, especially the first three metacarpals, that's the thumb, index, and the middle finger, okay? Atrophy of the thenar eminence, the palm of the hand at the base of the thumb of the affected side. This is a true symptom of CTS. The atrophy will look different. Will look like the affected side is either shrunken or substantially reduced in size compared to the non-affected side. So how do you know? Well, you hold the hands up together and you compare the base of one thumb with the base of the other, looking for any obvious differences, but especially one size dramatically or remarkably smaller than the other, if there's any curling in the fingers. And actually, this atrophy may be a symptom long before there's pain, numbness or tingling, etc. in the hand. Ask how the client is sleeping. In clinic, we found CTS sufferers often have some discernible insomnia or restlessness or sleeplessness. Now, there's a couple of different schools of thought regarding this. One is actually that improper sleeping mechanics, as in sleeping with the arm stuck up over the head on your side, so to speak, or with your arm up over your head at night, impinges the brachial plexus and cuts down, reduces innervation and blood supply to the hand. And this is actually what triggers some inflammation and some paresthesia, neurasthenia, some numbness, tingling, and that kind of thing, which we think of as CTS symptoms. However, I think of it in more terms of often before there's pain or regular constant pain, the client, and it's not just pain, remember, it's numbness, tingling, pain, lightning, electric type shocks in the hand, but long before those things start to happen, that people have trouble sleeping. And so that can be an early onset indicator. Look for noticeable issues of clumsiness with the affected hand. I had one therapist friend of mine that he would just spontaneously pick up a tennis ball and toss it to the client and see if they could catch it. And if they could catch it, well, that was a good sign. And if they couldn't catch it, or if they couldn't hold on to it, that was an indicator of a neurologic indicator of the hand having some issue. But could also just be so-called clumsiness and or banging the hand into things or dropping things. There's ask the client if they notice there's an increase of pain, pins or needles, numbness or tingling during the night or overnight. The flick signal. Ask, what do you do when you feel pain? Ask the client, what do you do when you feel pain? If they respond with a hand motion that looks something like shaking a thermometer, the doctor or the therapist can suspect that there's carpal tunnel impingement. All right, let's talk about some quick neurological assessments. One, to check function. Have the client open and close the hand. Can they open and can they close the hand? Can they do it quickly? Okay. Observe, does it work properly? can they place their hand on a flat surface or not? Okay, or if they place their hand on a flat surface, it causes them pain, numbness, or tingling. Have them extend the index finger of the affected hand and flex toward the thumb against resistance. So here's my affected hand, okay, and I'm gonna flex toward resistance, okay, and is it strong or weak, or can they do it or not? That indicates the innervation function of the dorsal interossi muscle of the second metacarpal, which is fed by the deep branch of the ulnar nerve. Failure to be able to push out with the index finger actually indicates impingement. Now flip the hand over, and actually I'm thinking more sideways here, in the thumbs up position. Have the client abduct, that means move the thumb toward the center of the hand, again against resistance, okay, to test the thenar eminence or for its innervation, because the thenar eminence, this fleshy muscle here, is actually also fed by the deep motor branch of the ulnar nerve, and failure to be able to flex the thumb inward against resistance indicates impingement of that nerve, which is a positive indication of clinical carpal tunnel syndrome. All right, here's more. We have what we call provocative maneuvers. All right, provocative maneuvers, just like it sounds, to provoke means to start or startle or to initiate. And the provocative maneuver is actually, we do this in other areas. For example, when we test a trigger point for a referral, where we actually put pressure on the trigger point to see, do you feel the distant pain? That's a provocative maneuver. For the hand, the provocative maneuvers are, first, the Durkin's median nerve compression test, which is place the thumb directly over the base of the client's thumb on the center line over the transverse ligament for 30 seconds. Now, the transverse ligament runs back and forth across here. Press firmly and hold for 30 seconds to a minute. If there's pain, numbness, tingling, i.e. paresthesia, primarily in the first three fingers, it's a positive test for carpal tunnel syndrome. So that's one for sure. And it's so simple to do. You can do this on yourself. Just get right there on top of that. Get right there on top of that transverse ligament, right on the at the carpal bones at the base of the first and fifth metacarpal, and just push right in there nice and firmly. This is just below where we think of as the palm chakra, okay? Which reminds me that in Ayurveda, carpal tunnel may be an impingement of the sen line, of the prana nadi, and of the palm chakra, the prana moving through the hand to come out the palm chakra. That any obstruction in that, what we would also call bone marrow chi, will look like a reduction or loss of function in the hand. All right. The next sort of classical test is called Tunnell's test, or Tunnell's sign or symptom. And this is, again, it's provocative, but it's real simple. It's just tap. You can start down here, and you can actually see, have an indication of where the primary impediment or inflammation or impingement on the nerve is. And as you're tapping here, okay, you're tapping on the median nerve, all right? And what happens is you will have an electric shock, jump, or twitch with numbness, pain, or tingling. All right. If you have those things as a result, that's definitely a positive sign. Now, some practitioners use a reflex hammer or use an instrument to tap the hand, but actually your two fingers here held together like this are more than strong enough to give a good tap, and it doesn't cause you any strain at all. All right, so provocative maneuver number 3 is a Phelan's maneuver or test, or Phelan maneuver or Phelan test, which is about bringing the backs of the wrists together forcefully, both of them together, and pushing them inward. Notice how I actually want to keep my arms level, the elbows up, the wrists are down, and I push the back of the palms together, okay, for 60 seconds. And then if as around 60 seconds or so, I start to develop numbness or tingling, that's a positive test. All right. And then we also have what we call a reverse Phelan maneuver, which looks like this. I'm going to go into these a little more detail in just a second. But basically, it's the idea of dropping the wrist, elbows up, and pushing the hands together. You can also do both the Durkin's test and a Phelan maneuver at the same time. All right, so let's look at that Durkin's median nerve compression test a little more. All right, once again, so here's the hand, and here's the palm, and think of the highest part of the thenar eminence and the lowest part of the thenar eminence as kind of a guideline, and there's a crease down the middle of the hand here, okay? That is the carpal tunnel region, but the ligament is what spans this musculature here. And so you just get your thumb on there and just take a breath and relax and just really just push in, okay? Hold for 30 seconds to a minute. If there's pain, numbness, tingling, i.e. any symptom of paresthesia, primarily in the first 3 fingers, that's a positive test. Okay, next we're going to look more at Tinel's test. These tests are really very simple. They're easy to learn, aren't they? So what I'm going to do is tap over the base of the palm with my index and second finger, and I'm looking to see when I do this, is there a shock? In other words, when I tap, is there a shock, pain, numbness, tingling in the client's hand? Now, by the way, you can do these tests that we're doing on the feet. They're neurologic tests for innervation going into the hand and foot. So actually, Durkin's and Tinel's test both you can also do on the feet. Okay. Now you can see this nice little illustration here. The backs of the hands are pushed together. This is actually a position in the Thai Rishi Yoga, which I've included some videos. And actually, not only is this a provocative test called Phelan's test or Phelan maneuver to test for carpal tunnel syndrome, it is also a treatment. Part of the treatment exercise or yoga therapy for the hands to actually correct carpal tunnel. Not by itself, and you don't hold long enough to create too much pain or a problem, but it is actually a yoga position. And same for here. This position, this provocative hand maneuver, which we call the reverse Phelan maneuver, okay, or doing Namaskar mudra, which is also called Anjali mudra. It's the prayer position, and when the elbows are down, it's ineffective. To do the test, you put the hands together like you're praying, and then draw a line down the straight down the center of your body, and let the elbows turn out until the wrists are basically on the same line as the elbows, and hold for 60 seconds with the hands relaxed and see if you get that numbness, pain, tingling, electric shocks, etc., etc. Okay? The idea here is that this position puts pressure over the carpal tunnel and constricts the tunnel, and any constriction or shortening or tightening there is actually going to cause the paresthesia. Okay? We also want to look now at range of motion. All right, so we have basically 3 kinds of range of motion. We've got active range of motion, which is where the client performs the motion under their own power. Okay, under their own power. Nice and easy. And actually, I always give the instruction, I want you to do some wrist circles, fingers open, fingers closed. I want you to take full responsibility for your comfort. I don't want this to be the most painful thing you've ever experienced, but I want you to try and do the most full range of motion in circles that you can on your own. Okay. The next is passive range of motion, or PROM. First is AROM. Okay, active. Second is passive. And this time, I take your hand. There's two ways I do it. One is hold the fingers and make circles. Two, have you lightly close your hand and make circles. Okay, three is lock the fingers and make circles. And four is cupping on top of the straight fingers and making circles. And I want to see if there's any restrictions or sudden pain, numbness, or tingling that comes about when you're doing circles. And I also want to see, is there any impingement on the flexion, extension, and rotation, or other words, the full range of motion of the wrist, of the whole hand, including the fingers, not just the wrist. The third range of motion, or ROM, is resistive range of motion. And this is where you move through your circles in range of motion, okay? But at the very same time, I'm going to hold on to your hand and I'm going to resist as you make this range of motion. And if you get moderate to severe pain with the previous exercises, you might want to just skip this because you already have a good idea. But if you didn't get any pain in the previous two range of motion, go ahead and try this. Okay? And then if you get pain while you're doing it, that's considered positive, and you can go ahead and stop right then and just move on. All right, so further under signs and symptoms, this is just, again, I cannot reiterate enough, just look for obvious signs of something's wrong with a hand. Look for signs of arthritis, redness, swelling of the joints, distortions of the fingers. Why is that? Well, because sometimes arthritis feels like carpal tunnel. So if in fact they have arthritis, you want to treat them for the arthritis. You don't want to necessarily treat them for the carpal tunnel. Have the client squeeze your hand and check for grip strength. Have them squeeze the hand and check for grip strength. Compare the affected and the non-affected side. Okay? And then we have what we call a 2-point pressure test for innervation. Gently press 2 points together on each of the first 3 fingers. The points are 5 to 6 millimeters apart. That's about half the width of your fingernail. Okay? And ask, do you feel the pressure? If the answer is no, then separate the points a little bit and repeat. Now, some Oriental therapists and some Thai therapists actually grow their thumbnail long and have it sharpened to a point. Same with the index finger. And they'll actually take their fingers like this to create the 2 points with their fingernail and push in. I'm not recommending that, even though it's actually traditional. Okay. Another thing you can use is a 2-tined fork. Or you can take a paper clip or a gem clip and you can just unwind it and distort it until you have 2 points that are approximately half the width of a fingernail apart. And you test, and if they do not feel pressure, then separate the points a little bit and repeat until they feel pressure, hopefully. The wider the gap, the stronger the indication that there's something wrong or that's a pathology. All right. So I'm not asking you here in this lecture to medically diagnose the symptoms of carpal tunnel syndrome. But as a yoga therapist, specifically as a SomaVeda Thai yoga therapist, you are empowered, you are instructed to do assessments using signs and symptoms. This is classic for Ayurveda. This is in addition to our Nadi Vigyan, to taking the pulse, determining any particular dosha that you might want to have as an emphasis. And it's just to give you a more specific understanding of what you're dealing with so that when you do the carpal tunnel treatment, you'll be able to actually do these tests again after you've done a program to assess whether that protocol worked or not. All right. God bless. Kapku Makap. Namaste. Thank you so much for this. Giving me this time for the presentation today. I hope it's helpful.